My name is LauraEllen Ashcraft, Assistant Professor of Epidemiology, and I'm a social worker by training. I earned my bachelor's degree from Millersville University of Pennsylvania and my master's and PhD from the University of Pittsburgh. I am also the first person in my family to complete a master's degree and a PhD. Throughout my career, I have been deeply engaged in community work and political advocacy, both personally and professionally. I eventually became an implementation scientist after noticing major gaps between the evidence we know works and what was actually happening in clinical practice. I saw this gap especially clearly through my policy work. When I met with state legislators, I realized they often didn't have access to or didn't review the peer-reviewed literature in the way we do as academics. While I now know that this issue is more complex than that, I wanted to help policymakers receive evidence in a way that made sense for their decision-making. That motivation is what ultimately led me back to school to pursue my PhD. In my work here at Penn Medicine, I serve as an implementation science methodologist. This means I collaborate with investigators by providing implementation science expertise while also working to advance and innovate the theories, methods, and analytic approaches used in the field. I currently work on projects funded by the NIH, the VA, and Penn Medicine. My VA research focuses on supporting older veterans, both in the inpatient and outpatient settings, to receive goal-aligned, evidence-based care using the age-friendly health system model. We recently completed a 5-year outpatient implementation trial and are now beginning a 5-year inpatient trial. I am also in the second year of a maternal health grant funded through the NIH Improve initiative. In this role, I provide implementation science consultation to 12 maternal health centers of excellence across the country and 4 community implementation programs. I also co-lead meta-science work in implementation science and maternal health with Dr. Rebecca Ham. This qualitative longitudinal study aims to understand the factors that contribute to high-quality implementation science in maternal health and uses newer methods to assess the strength of barriers and facilitators over time. I am also part of the CFER leadership team, a group of about 10 global scholars who develop and disseminate best practices for the consolidated framework for implementation research, the most widely used implementation science framework. We recently published the long-awaited CFER user guide. This work is important because implementation science, when it's done well, helps to ensure that evidence is actually put into practice and sustained over time. It gives us the opportunity to make sure people receive the treatments or interventions they need, regardless of where they live or what insurance they have. Implementation science still has room to advance, and one of the things I love about this field is that I get to contribute both to important content areas like maternal health and supporting older veterans, and to improving the methods, theories, and analyses used across implementation science. When we strengthen these approaches, the methods developed in one study can be applied across many different topic areas. Ultimately, this work has the potential to improve how implementation science is conducted and ensure we're doing everything we can to move evidence into practice. Looking ahead, I'm working on several collaborations across our department. I'm part of a grant application that includes principles from informatics to generate methodological insights in implementation science. We plan to use AI to identify what works in implementation research and to synthesize lessons across topic areas and disciplines in collaboration with Drs. Joe Romano and Danielle Mowry. I'm also partnering with colleagues in Biostatistics to evaluate alternatives to commonly used study designs that often don't work well in real-world settings. This is a challenge I see frequently in my consultative and mentoring work. I'm especially excited to collaborate with Dr. Elisa Stevens-Shields to articulate the limitations of stepped wedge trial designs and propose alternative approaches. I currently teach the first PhD-level implementation science course at Penn, which I designed to support scholars who want to innovate in theory and methods. My goal is to teach this course every fall and eventually expand it into a second advanced methods course.